Hello, everybody. This is Dr. Chris Link, Medical Director of the Integrative Medicine Clinic. And one of the most common questions I get, and I'm surprised that I still get this question, that is coffee good for you? Is it safe? Is there detrimental effects? Can I drink my coffee? Can I enjoy my coffee in the morning? And over the next several slides, I hope to answer that question for you. I recently attended a talk by Dr. Frank Yu, Chairman of Public Health at Harvard. And he presented this slide. He said that there are in fact multiple beneficial health outcomes to drinking coffee. There's less type 2 diabetes, less oral cancers, less liver disease and liver cancer, fewer kidney stones, less of the blood cancer, leukemia, less episodes of gout, and better outcomes after heart attacks, to name just a few of the benefits of coffee consumption. One of the most important studies ever performed was the Harvard Nurses Health Study and Health Professional Study. It has followed physicians and nurses over the last 20 to 30 years, over 300,000 participants. And in that study, it clearly is shown that there is a strong inverse association between coffee consumption, and that's dose dependent. That is, the more you have, the better it is in regards to decreasing cardiovascular disease, neurological diseases, and even depression and suicide. And it turns out that it didn't matter if it was caffeinated or if it was decaffeinated coffee. Coffee indeed has neuroprotective effects. People that drink coffee on a daily basis, 25% decreased risk of Parkinson's disease, about a 20% decreased risk of Alzheimer's disease. And at 3 cups or more daily, suicide risk is decreased by 45%. And in the studies related to suicide and depression, the caffeine did make a difference. The mechanisms for coffee consumption and its health benefits are related to the many anti-inflammatory components and polyphenols, things like chlorogenic acid, and the fact that the caffeine in coffee increases the neurotransmitter dopamine, which is a neurotransmitter of motivation and of pleasure. According to Diabetes Care, the journal in 2014, caffeinated or decaffeinated coffee consumption significantly reduced the risk of diabetes. 1 additional cup daily decreased the risk by 11%. And those that were drinking coffee and decreased their coffee intake by 1 cup daily actually increased the risk of diabetes by 17%. What they concluded was that coffee consumption was inversely associated with the risk of type 2 diabetes in a dose-response manner. That is, the more they drank, the better they did. This is in the very important medical journal Circulation from the American Heart Association. Long-term coffee consumption and the risk of heart disease, cardiovascular disease. A very large study, 1.3 million participants. There was a 15% decrease in cardiovascular mortality if a person was to drink 3 to 5 cups of coffee daily. They concluded that moderate coffee consumption was again inversely associated with cardiovascular disease. That is, the more coffee a person drank, the lower the cardiovascular risk was. And it continued up to 5 cups daily at least. This is 2017, the Annals of Internal Medicine. Coffee drinking and mortality across multiple European countries, 10 different countries. This is the EPIC study, and it had 500,000 participants. Men who drank coffee had a 12% decreased risk of all-cause mortality. And all-cause mortality is a statistic that looks at dying for any reason below the age of 75. For women, there was a 7% decrease. In all, the men and the women, they had improved liver function, decreased inflammation, and a decreased average blood sugar. Coffee was associated with a reduced risk of death from various causes in this study. And it didn't matter which country you lived in. Now, this is a very recent paper, June of 2019, and it talks about how coffee actually helps us burn calories. And what it does is it changes some of the fat tissue in our body to more of a brown adipose tissue, and brown adipose tissue is known to help us burn calories and to increase body heat. whereas the white fat that's typically stored under the skin is simply a storage house or a vessel um, for energy or fat, whereas the brown fat is actually metabolically active. So the results showed that coffee increased the brown adipose tissue and that brown adipose activity contributed to weight loss strategies. Wow. So back to that question, is coffee good for you? And I can say with a resounding yes, it's good in many ways. So if you enjoy coffee, brew it up, and it can be part of a wonderful food as medicine approach where you use nutrition, lifestyle, and exercise to improve health and to ward off medical conditions. Again, this is Dr. Chris Link from the Integrative Medicine Clinic. I hope this made your day, particularly those of you out there that are coffee drinkers.